very heartfelt thank you to my sponsor, Dr. Hickey. I've just had the most wonderful experience going through this with you for almost a year now. And I think that what really we achieved in this is something I'm very proud of and I'm very grateful. All right. So just a brief layout of my presentation. I'm going to give you a start sorry, starting with some introductory materials. So the inspiration behind my project, some key contextual findings from the literature, a brief description of what I actually did in the project, what I found from that, and also potential significance for future research, which I believe is ultimately the key point of my project. All right, so my project was actually inspired by my own sister's experiences. So it was actually 2 years ago now when she experienced a fairly severe injury to her meniscus while playing soccer. And you can see it actually right here in the x-ray that I've provided. You can also see the patellar fracture to her right knee. So obviously this is a timeout injury. She couldn't play for several months at a time. And I definitely saw the level of stress that was weighing on her. And as someone who has never really played in competitive sports, I really couldn't understand firsthand what that meant for her, that level of stress and the anxiety that she felt trying to get back to her sport, which was really the driving force between what I want to dedicate my project to. So just some key context from the literature. So obviously we've seen increased participation of young female athletes over the last 50 years, stemming from obviously Title IX. And specifically, we're seeing soccer become a a very popular sport for all ages, all all groups of people. And of course, this is a very knee strenuous sport. We're going to see a lot of lower extremity injuries, but we particularly see high knee injury prevalence at the high school level, at the adolescent level, which has been found to be more prevalent in groups of young female athletes on a number of levels, a number of scales. So, with that greater risk, we also acknowledge that there's an ongoing trend towards specialization at the moment. So, athletes dedicating year round practice, year round competition to a single sport, often at the exclusion of others. So, soccer being a very specialized sport, what we're also seeing is that compounding levels of risk for young female athletes who are already at a risk for knee injury because of this sport, but now we're seeing this added level of risk. Okay, so specifically, I want to focus on the knee injury, obviously because of my sister, but also because it's very prevalent in a number of sports, particularly soccer. And of that, the ACL is probably one of the most highly researched in terms of rehabilitation, treatment, and prevention. So I would say the most common is the non-contact form, meaning not necessarily a direct hit to anything, but usually from a sudden change in acceleration, a sudden change in direction, which causes overuse or acute injury to the knee. And we actually see a pretty decent margin of increased prevalence for young female athletes. And this leads into sort of innovation for surgical interventions because previously the usual route that they would take was to either brace or try and stabilize the knee because young patients are still skeletally immature. But now we're seeing recommendations of early surgical intervention. And what we're seeing from that impact is that one of the major methods is an autograft. So taking hamstring tendons to either like replace or supplement the ones that have been injured in the knee. But what we see is that for young female patients, there are more trends toward revisions that are actually needed following that surgery. So what we're seeing is that in addition to the risk of injury, we're also seeing risk of need for continued surgical intervention, continued rehabilitation. And from that rehabilitation, there aren't really any widely accepted singular sets of criteria for determining physical readiness to return to sport. And they haven't been adequately applied to this young population, which is especially important given that there are increased rates of re-injury, especially for patients who return earlier than 9 months, which is usually the typical recommended time to spend away from sport before you return. So, given these sets of findings, what I had really hoped to determine with my project is to use survey methods because obviously in a pandemic, I couldn't interview people in person really, and I really couldn't go to sport events when they were all disbanded. So I did use online surveys with a total of 37 items. And of that, I had a total of 10 participants, which means obviously my subject pool is very limited. But uh, with the age group, I think that I was happy with what I had received. And both high school and club soccer teams participated, but mostly limited to the Yorba Linda Placentia area. All of the participants actually listed soccer as their main sport, and only a few listed secondary sports, mostly being track. And they all reported experiencing injury at some point during their soccer career. All right, so specifically for the questionnaires I use a couple of established questionnaires that have been used frequently in sports medicine. So the athletic identity measurement scale, which is to determine sort of the extent to which a person identifies with the social role of the athlete in terms of like self-perception, also social appraisal, but also the emotional response of athletes to injury questionnaire, which has more various formats. So there's quantifiable ratings, but also short answers to get more personalized data. Okay, so specifically for the ERAIQ, when they asked particularly about knee injuries, 6 out of 10 did confirm that they had experienced some level of injury, whether it was just bruising all the way to complete ligament tears. And 100% of them actually did say that they did return to soccer following this injury and following other injuries as well. And because they are mostly involved in soccer, for I believe 60% were only involved in soccer. This does reflect that previously mentioned trend of specialization. And interestingly, 70% actually report that the greatest pressure they felt to return to sport following that injury came from their own selves, their own intrinsic motivations. And also, many reported that the goals that they had in sport hadn't changed just because they were injured. And I will talk about these goals right here. Uh, so most of them reported that what their goal was for playing in sport was to advance to the college level, to engage in self-improvement, and also wanting to contribute to their team. This really plays into this also feeling of support from that team, from friends, family, teammates. So you do see this sort of social web of the role that they play because they are involved in athletics, which also additionally plays into more internal, more internal reported feelings, so frustration, but also this conflicting fear of pain, re-injury, anxiety. So what we're seeing is this definite interplay of intrinsic motivation, wanting to get back to sport, which is also compounded by wanting to return to that sort of social web of support that they experienced playing in a team sport. And as for the athletic identity, so a score of 1 means that they highly agreed with the item which is listed in my table, and a higher score means that they more disagreed with it. So the most conflicting item was that sport is the only important thing in my life, with a score of 5.4 out of a possible total of 7. So what we're seeing is, interestingly, they do consider themselves an athlete. They have a lot of goals related to sport, a lot of friends related to sport, but it's not necessarily their only priority in life, which might be reflective of their young age. Obviously, they're in high school, have a lot of friends, have other goals that they have just besides soccer, even if they're playing on multiple teams. So, as I had mentioned before, I do have a fairly limited subject pool, meaning that I'm really just making suggestions for future research to use this as a basis, really, because in my own search for the answers I was seeking, I didn't find a whole lot of studies conducted on this specific age group, even though it has been fairly widely agreed upon that they are a vulnerable population to this specific type of injury, which has yielded further rates of re-injury and also long-term health consequences like osteoarthritis. So what we are suggesting from these results is that in this young population, there are, of course, strong internal motivations to return to sport for the goal of bettering themselves and advancing to higher levels of play, which could indicate that sport draws these types of personalities, people who are competitive, people who aim for self betterment, but it also indicates that this particular population should be monitored for those reasons because of those internal drives, which might lead them to make decisions that aren't the safest because they want to return to sport, they want to return to the role that they've identified for themselves. Because this loss of identity, especially at that age, I think it can be, cause a lot of anxiety, cause a lot of frustration, wanting to return to the thing by which you identify yourself, by which you have gained all of your friends, have gained most of your like social connections. So we definitely see this sort of interconnection between the self perception in terms of sport and also the sort of social support, but also to an extent social pressure. So for future research, what I had noticed in my own gathering of survey data is a couple of response errors, mostly due, I believe, to the wording of certain questions, because these questionnaires were, I believe, obviously created for older populations, not necessarily for teenagers. So there were a couple issues of, ranking questions where perhaps I think the wording of the question wasn't exactly understood completely, which led to results that I believe were entirely accurate, maybe were entirely correct in reflection of what they were actually meaning to say. So the significance, and I think what we really take away from this is trying to draw more attention, I would say awareness in the public conscious to this particular young female population in terms of growing bodies of elite clubs of soccer and also high school teams, because they are at a very particular injury risk that is really only compounding with trends toward becoming more specialized, joining more teams, higher competition volume. So this, I believe, is really the basis to encourage for future research, because we're seeing this potentially long-term impact and also acute impact because they're at a young stage in their life and this could be incredibly debilitating. So what I've really tried to assert is that rehabilitation methods should include beyond the immediate physical injury, because if we aren't assessing young athletes for their actual mental and emotional readiness to return to sport, they might be making decisions that aren't with their best interests in mind in terms of long-term health and a long-term quality of life. And drawing this into my major, as Professor Wren mentioned before, I did craft a major called Holistic Physiotherapy, which is meant to include the whole person perspective. So looking at this interplay of physical health, mental and emotional states, and social surroundings, how this all comes together to how people perceive their health and how they perceive their rehabilitation, their recovery. So what I really want to emphasize is more than prevention, beyond injury treatment, more so this understanding that even recovery from an injury has much more facets than just whether physical function has returned to the extent that they were before. It's also these emotions that have been building over time and that have been driving them to return to a sport where they might not be entirely safe because of this previous injury. And that is really what I want to emphasize. So thank you very much. Also, if you're wondering, all of the pictures in here are of my sister, just sprinkled in there for you guys. And here are some of my references. And that's all.